Good morning again. Is everybody having fun? Nice. Okay. This is the last little bit of the meeting. We're going to sort of wrap things up and meet some interesting people who are contributing to the future of scoliosis. First one is Michelle. Michelle Marks is the Executive Director of our foundation, and she and her colleagues are the ones who really did all the work to put this together, and it was one of her ideas and one of her passions that she wanted to be involved with patient education. So I'm going to turn it over to her and let her discuss some of her findings from which she's even learned this morning.
Well, hello, everybody. I haven't even said anything yet. So as mentioned this morning, I'm going to share with you our initiative for patient-based research. I'm a PT and now the executive director of this wonderful foundation, and I've had the privilege to work with the Harm Study Group for the past 18 years and doing scoliosis research and now running this wonderful foundation. So first I want to just say thank you so much to the chairman who organized this meeting, Dr. Dave Clements and Dr. Sukan Shah. They give so much to their patients on a daily basis and now give back on this level is just so admirable. And a huge thank you to our local surgeons in Philadelphia, Dr. Pays, Dr. Gabos, Dr. Cahill, Dr. Samdani, Dr. Flynn, and Dr. Huang. This is our inaugural patient education course, and we are so grateful that you've helped make it a success. And without the support of our institutional sponsors and our industry sponsors, really today would not have been possible, so we are extremely grateful. Thank you. And most importantly, you guys, thank you for attending and participating today. We designed this event with you in mind, and it's our first, so we would really appreciate your feedback. You'll be receiving a survey following the course, and we'd really love for you to submit some honest feedback on what we could do better, but really what you enjoyed. So the Harm Study Group just celebrated their 20th anniversary, and for the past 2 decades, they've been a productive group of collaborative surgeons. But their research aims have all been based on clinical questions which were defined by doctors and healthcare providers. So the impetus behind this patient-based research initiative is really to change the way we do research. Our goal is to develop research studies based on clinical questions that are important to patients with scoliosis. This initiative will help us develop patient-centered research. With this effort, we hope to establish and grow a patient community composed of patients and parents of patients afflicted with scoliosis, because these are really the key people that are going to help us move our research to a new level. We hope to define patients' greatest concerns with regards to scoliosis, and most important, begin to establish these patient-based clinical questions. This is the perfect opportunity to infuse the wisdom of patients with the rigor of science. This initiative will help us submit some wonderful grants to an organization called PCORI, which is really focused on patient-centered outcomes. We started this patient-based initiative through funding donated from a grateful patient, much like yourself. And we're lucky to have a wonderful board member, Stacy Goldfarb, who's with us today, who is a past patient herself. And she has brought an incredible patient perspective to developing this program. So what have we done? In 2013, we attempted to identify the top priorities of our Harm Study Group surgeons. And we took those clinical questions that the surgeons had, and we grouped them into categories and had them rank them from the least important to the very most important. And then we gathered our first group of patients, and we did exactly the same thing. We had gathered these clinical questions, grouped them in categories, and had them rank them. And we've done it both in 2014 and 2015. We then did a comparison of the research prioritization between the clinicians and the patients. And we looked at the ranking of the topic areas between these two groups. So there were 26 scoliosis clinicians, and they ranked 10 research topics. And we had 32 wonderful patient partners, and they ranked 7 topic areas. From this comparison of surgeon ranking versus patient ranking, we found that both groups ranked long-term follow-up in AIS scoliosis surgery as the #1 priority. That made me very happy. And other top areas in agreement between the two groups were the effects of scoliosis on quality of life and the outcomes of untreated scoliosis. So this evaluation was really eye-opening because it gave us a glimpse into the alignment between patients and clinicians' research priorities. And it started us in the right direction to ensuring that our focus of our research is going to be important to both those delivering care and receiving care. I'm proud to work with the surgeon members of the HARM study group who are really the thought leaders and the role models in scoliosis research. And they really have the vision to ask the critical questions, and they're really willing to put in the work to actually get the research done. But what's even more inspiring to me is this shift where they're really desiring to do the research that's important to patients. I'm really grateful to all of you who took the time to submit some research questions ahead of, we sent a survey out, and we got some really great ideas seen here on this slide. I'm not going to read through all of them, but we've had some wonderful ideas submitted so far. And as was announced this morning, all during the sessions, we had ideas submitted today, which is great. Everybody's thinking about what can be done and what we should do in the future. What I'd like to do is synthesize all of these ideas and circulate a document to all of you following this meeting, kind of touching on maybe research that's already been done and maybe spark some ideas of what you had with that area that you thought might be important to answer that hasn't been done. So if you're interested in participating in this exciting partnership, please email me, text me, or call me. You're going to be an incredible and valuable resource for us, and we will engage you as much as you would like to be engaged with helping us through this mission. You're going to become, if you partner with us as one of our patient partners, you're going to become acquainted with an amazing team that I work with, and I can't thank them enough for all that they do every day. And a huge thank you to Chloe. I don't know if all of you had the chance to meet her today, but I want to let you know that she just joined our team 7 months ago and today brought you this amazing patient education event. But I'd really like to make you aware of the reason I think the HARM study group is able to do such amazing research, and the reason the Setting Scoliosis Straight Foundation is able to reach and educate patients like you. Dr. Newton is quite simply, I feel, the best example of dedication, compassion, and integrity, and he's a wonderful leader, president of the HARM study group and Setting Scoliosis Straight. So thank you. Please stay in touch with me and be well, and thank you for coming.